Hi, I'm Jeff Berg. I've been with Town Center Orthopedics for 25 years. I specialize in sports medicine and primarily take care of knee, shoulder, and elbow problems. So the ACL is a ligament in the middle of your knee, and it helps prevent instability in both the front and back direction and in rotation. And any injury to that ligament would be considered an ACL injury. ACL injuries occur with pivoting and landing injuries. And since those activities are so common in sports, then ACL injuries are common in sports. However, they can occur with any activities in which somebody jumps and lands or cuts and pivots, such as jumping off a ladder or hiking. Avoiding ACL injuries can be difficult. Even professional elite athletes who are in top shape and train all the time can tear their ACL. However, some things that might prevent injury, and particularly ACL injuries, is just staying in good shape. We think that if somebody fatigues, they're more susceptible to injury. And there are some particular ACL prevention programs that we think may be able to reduce ACL injuries to even about 50%. So there are two types of treatment for ACL injuries. In the first, if people are not involved in pivoting and jumping activities, many of those patients can be treated non-operatively. And usually we'll treat with therapy and see how they do. And if they do well, great. And if they don't, then we'll go to surgery. In those who are involved in pivoting and jumping activities, though, my recommendation would be for surgery. So after an ACL surgery, there's really three things you need to return back to your sport. One is we got to give time for the ligament to heal. And that can take up to 1 to 2 years for it fully to recover. And so as much time as we can give, the better. The other is that the patient has to be mentally ready to return. Some patients after ACL injuries and ACL surgeries may have some fear or reluctance to return to their sport. And if you participate in a sport and you're reluctant, you're more likely to be injured. And the third thing that somebody needs is they need to be physically ready. So they need to have the strength, the endurance, the ability to do the basic skills needed for their sport. And they need to be able to do that safely and without thinking about it.